Hi, welcome to Utah Valley Psychology. My name is Pat McGuinness, and I recently joined the practice here in August of this year, so 2020. And I thought I'd tell you a little bit about myself, my background, maybe what's unique about the way I practice, and the kind of clients that have found me helpful. So I see individuals, couples, families, and usually adults, adolescents as well. Um, I work with people suffering from depression, anxiety, uh, dealing with relationship problems. And I do a lot of work with post traumatic stress and dissociation. So I guess what's a little bit unique about the way I work is I tend to be a little bit more interactive with my clients. I do a lot of listening and a lot of reflecting and a lot of answering questions. But I also tend to be pretty active with my clients. So they tell me, and I guess there's two reasons for that. One is probably my personality, and the other is that I use a procedure quite a bit, which is kind of unusual in psychotherapy to use procedures. But the one I use a lot is called EMDR, and that stands for eye movement desensitization and reprocessing. So, given that that's a mouthful, we just refer to it as EMDR. It's a pretty unique procedure or technique. We use a lot of eye movements, we use a lot of hand taps, and it's a long story. I'll do another video on it in more depth, but to give you a little thumbnail, this is one of the ways I apply the bilateral stimulation that we use is through eye movements, and this is a little tool my mentor gave me. And what we do is you keep your head focused straight, and then you follow the yellow thing with your eyes, trying not to move your head, right? And then we do a series of saccades. We do like a set, and then I'll ask you to reflect on your experiences. And that's not really enough information, but it gives you an idea about how it's a little bit different. And when you're dealing with post-traumatic stress or just intense emotional issues, people tend to dissociate quite a bit. And so I've gotten pretty good at using ego state therapy and internal family systems therapy, which is just methods of managing dissociation and really helping you get to some emotions and some internal conflicts and working them out. Another area that's a little bit unique that I focus on is psychedelic integration. And long story short, we have a lot of ketamine clinics here in Utah. And there's a lot of folks that do the ketamine therapy to deal with treatment-resistant depression, things of that nature. And they do get a lot of relief from the ketamine treatment, which is a psychedelic experience, meaning there's a lot of epiphanies that go on mentally and sensory changes that people experience. But anyhow, that's how it's being used here. And the other thing too is, a lot of people use psychedelic drugs illicitly, illegally, okay? And sometimes people have bad experiences with it. They say they're called bad trips a lot of times, but really they're often ripe with emotional material that needs to get processed and just never got processed, and the person wasn't able to deal with it when they were in that psychedelic state. So I help people integrate that so they can use it as a transformation rather than a trauma. So I will also do another video on that. So I'll do a video on EMDR for those who are curious about that, and one on psychedelic integration. And but other than that, I'm pretty much run-of-the-mill therapist. But I'm here for you if you want to work with me. So just call them at the front desk and schedule an appointment, and we'll look forward to meeting you and working with you. And that's it. You take care.